Kevin, you currently have a number of patients who are being treated here as a result of the Tunisian terror attack. Now, obviously, patient confidentiality means that you're not able to discuss individual cases, I understand that. But generally, can you tell me how these patients are?
We are seeing a few patients as a consequence of the tragedy that happened over in Tunisia at the back end of last week. The patients that we have are generally doing well and are recovering.
Well, that's great news, obviously. Heaven forbid that the day would ever come, but would the Trust be able to cope if there were sort of a major accident or, God forbid, a terrorist attack? Let's say a plane crash or a big accident. How would the Trust cope with something like that?
So we have what we call a major incident plan, and we practice this continuously. And if something happened that was a major incident, we'd need to call in staff, we'd need to focus on keeping people safe and secure. We have contingency plans that would kick into place immediately. And they don't just cover us, they cover sort of the police, fire, ambulance, and we work across agencies, and we continuously train and home in our major incident plan. So clearly we don't know what it would be, but we're as prepared as we possibly can be.
How often would you plan for that? Is that something done on a yearly basis?
Well, the actual major incident plan is updated on a yearly basis, but we have, on an ongoing basis, we have desktop reviews. We even have some practices that take place across the health and social care system for such instances. So it's a continuous process.
Right, well, I'm sure the patients in general would wish those that were caught up in that horrific attack in Tunisia the very best of luck and well wishes. It's been in the news locally a couple of times. I'll put you on the spot. Are there any plans to close Accrington Victoria Hospital's restaurant?
We have no plans to close Accrington Victoria's restaurant. I'm not quite sure where this actually came from. We are looking at how we provide services right across the organisation, and we have financial constraints and we have financial pressures, the same as every health organisation, but we have no plans to close the Accrington Victoria canteen.
Question I got into the Patient Voices Group email address regarding maternity services coming back to Blackburn. What's that all about? Because as far as I understand it, there are maternity services here in Blackburn, aren't there?
So that's news to me. I've not heard of that one. We have, I think, across East Lancashire, we have probably the best women's and children's services that I've seen anywhere in the country. They are first rate, they're outstanding. And we have the main unit on the Burnley site, but then we have birthing centres and birthing units across the patch. A really fabulous one in Blackburn itself. We have no plans whatsoever to change those facilities. In fact, we're looking to improve on those facilities, not reduce those facilities.
So recent news tells us that thousands of foreign nurses working in junior posts in the United Kingdom could be forced to return home under new immigration rules. A new pay threshold for migrants means that non-European workers will have to leave the UK after 6 years if they are not earning at least £35,000. The move is part of the government's effort to control net migration, but the unions say that by 2017 more than 3,300 NHS nurses could be affected. Kevin, my question to you is, would this affect the East Lancashire Hospitals Trust?
So my understanding is that is now being looked at and has been reviewed on a national basis, and clearly we have to wait for the outcome of that review. What I can say is that we have a number of foreign nurses that go back over a number of years. We had a very successful recruitment campaign, I think it was about 10 years ago or so, from the Philippines, and a number of those nurses are still with us now and provide brilliant services throughout our services and to our local population. So we would not want to lose those staff at all. I can't say whether we will. We need to wait for the national review to take place, but I am as confident as I can be that we will keep hold of these staff.
As you probably know, under previous chief execs here at the Trust, I've seen firsthand how demoralised staff can get when their concerns aren't listened to. And whilst undoubtedly I've personally seen a change much for the better, I have to say, in the morale of the staff, I've had reports recently from hospital consultants, particularly theatre staff, about bullying in the workplace and concerns that they're not being listened to. Now, in reference to patient safety, that is, What, as Chief Exec, would you say to me, what assurances would you give me that you will take this on board and support them?
So the first thing I would say absolutely is that bullying in any circumstances or under any circumstances is not acceptable. And if I see it and I come across it, then I will act very decisively, so because that is just unacceptable. I certainly don't want to work in an organisation and lead an organisation that has a bullying culture. So say that just, immediately. If there are issues and staff wish to raise concerns, we have really strong processes now in place, I think, through whistleblowing processes, through duty of candour requirements for staff to raise those concerns. But what I would say is, people have those concerns, just let me know. Pick up the phone or email me, and I will ensure that we follow them through and we act upon them and we get to the bottom of what's going on. I think, you're right, we have made great strides, and one of the things I'm really pleased about is we're going to be named shortly in one of the top 100 places to work in the NHS. So I think that's really, really powerful and positive, but it doesn't mean we've got everything right. And therefore, where there is instances of bullying, where people do want to raise concerns, please, not only, I would say to you, it's actually your duty to raise them, because it's only by raising it that we can root out these issues.
And I think certainly the staff understanding and knowing that your door is open and that you are approachable would certainly, hopefully, give them that impetus to contact you.
Absolutely.
I've had an increasing number of patients contacting me to express their anger at some nursing staff who seem to think that it's appropriate for one section of the community to have 10 visitors to a patient bed, whilst others are scorned upon and generally treated like second-class citizens when they have 2 or 3. Those are their words, not mine, by the way. Now, I understand that there are cultural elements to consider, particularly if a patient is thought to be passing away. But should there be a difference, Kevin, in the level of consideration given to patients from different backgrounds by your nursing staff?
Well, I think we have to treat each case on its merits and each case differently. And hospitals need to be very open, very, very welcoming places. And we need to think about the needs not just of patients but also of family and relatives. So I think we have to treat each case on its merit. There will be occasions when, for really legitimate clinical reasons, even for the patients themselves or for other patients in the unit, where nursing staff have to ask and have to be more strict in terms of visitors, and clearly we need to do that. But what I would say is, we have to be open, we have to be welcoming. We are a place where we need to welcome, everybody, and so I wouldn't really want to put those restrictions in place.
As you mentioned earlier, the Trust has recently made it onto one of the best places to work lists, so congratulations for that. Can you tell me what you personally are doing to continue to motivate staff, given the difficulties that the hospital trust has had in the past, and perhaps tell me about plans that you've had to recruit more A&E specialists and nurses and things?
The jobs that people do in the NHS, particularly the frontline clinical staff, I think some of the most difficult jobs, but also some of the most important jobs that anybody can do anywhere within society. We're not going to be able to take away all of that pressure because the nature of the jobs are that they're very pressurised. But what we have to try and ensure that we do at all times, that there are the right number of staff, the right training and the right support. What we need to then do is look at staff themselves and protect and support their own health and well-being. So there's lots of ways that we do that. We have a really active now health and well-being program within the organisation. We have a really strong occupational health program within the organisation. But more than that, I think it's about a culture in the organisation where actually we all look after each other, and every member of staff looks after everybody else in terms of the staff. And when somebody's having a bad day, somebody's feeling down, we're there and we're all there to support them.
Because on the back of that, I don't think that certainly patients will probably realise that staff are patients too. They suffer from all the same ails and ailments that the patients do. And stress also is presumably a big part of working here at the Trust, like any other large organisation which is dealing with large numbers of people.
Yeah. I mean, I think if you went round our wards and departments, you would see that stress is a significant issue. You think about working on a ward or in an A&E department or in a busy outpatient department where people are coming in, they're concerned, they're ill. you're not only dealing with the patients themselves, but the anxieties of their relatives and friends. There's a lot of stress on staff. These are really, really difficult jobs. So it's important that we support staff. I think we've done a lot to try and improve that, but I'm sure there's still much more we can do.
Talking of A&E, as I was a moment ago, are you able to share the figures? How are you with A&E and waiting times? Obviously, it's a national problem, not just a local thing. But are those figures improving?
Our figures are not bad, but they need to get better. So the national target is that 95% of all patients who come through into an A&E department should be seen within 4 hours. We're somewhere around just under the 95%, which is better than most on a national basis, but still not where we want it to be. One of the problems that we've had is that because these jobs are so difficult within A&E, there has been a difficulty in terms of recruiting, particularly doctors, into the A&E department. So we're trying to go on a quite aggressive campaign to recruit doctors into the A&E department and try and bring a number in all at once so that they can support and protect one another and come in as a cohort. But it is a national problem. There's a national shortage of A&E doctors.
There are growing concerns regarding the uploading of confidential and sensitive patient data to NHS England or the Health and Social Care Information Centre, or HSCIC. Now, this latest scheme involves GPs and is called Care Data, and patients might be surprised to learn that the sharing of their hospital data has been shared for years with universities and the Department of Health, and more contentiously sometimes with private companies. Not you specifically, we're talking in general. As an organisation, though, do you feel it's right to share patient data outside of the trust? And how would you explain to patients, does this help improve the future care of patients? How does that work?
So I think what we've got to be able to do within health and social care is to share data between social services, between GPs, between community services and between hospital services. What I always find is a really nonsense thing is that, we can have really good information on patients in terms of their health in the hospital, but being able to then to pass that to GPs or into community services can be difficult. And clearly, patients don't just finish the treatment once they come out of hospital. They have social services and they have social needs. They have needs that GPs need to service. So we need to be able to, recognising all the confidentiality issues and being able to protect the data, we need to have a way of being able to share data so that people can get the best care. And the only way they can get the best care is by the professionals having access to data that's going to be necessary to help support people. And I think we do need to improve on that in Pennine, Lancashire, between GPs, between the hospital and between social care services.
Nationally, obviously, there continues to be pressure upon hospitals, particularly A&E. How can patients support the trust and perhaps ensure the best use of what is in effect a limited resource?
So absolutely, I think it's a really good question, and we do have limited resources. So, we still find many instances when people do turn up inappropriately at the A&E department. And when anybody turns up, we will always look after them. Clearly, we will always treat them. That's what we do. That's what the hospital is about. But if people are turning up for very minor illnesses or ailments that they could have either gone to the pharmacy, or they could have gone to the GP, or they could have just self-medicated for, that does take time, and it puts more pressure into the system, and it means people who genuinely need the services may have a slower access time. So what I would say to anybody is, if you absolutely need the A&E department, turn up. You will be treated, you will be seen. But if there's a way that you've got minor illnesses where you can self-medicate, or you can go to your pharmacist, and they're a great source of support and education, or your GPs, please do that, and just think carefully about whether you do need to turn up at the A&E department or an urgent care centre.
Would you then, on the back of that, agree or disagree with me that there needs to be more education and more joined-up thinking between healthcare agencies and other social care agencies in educating patients and members of the public into the appropriate use of services? We seem to have drifted along for years and basically put up with people attending at A&E, and it isn't a finite, an infinite resource. The resources are finite. education is better, would you think?
I'm sure there's much more we can do. I think that's a very fair observation. I mean, we do try and do a lot of stuff. So, for instance, last weekend we took out a full paid ad in one of the local papers to ask people to think about, illnesses and ailments and where they should be treated. So we do a lot in terms of communication and in terms of education. But I think you're right, there's more that we should do across the services to join that up and to provide education.
It's all very well, and I'm playing devil's advocate now, Kevin, placing ads that people may or may not see. And I think for years it's certainly been a thought of mine that we in this health field have a duty to sort of get out there into the communities. The only way we're going to really truly engage with people, other than Facebook, if we want to engage young people, or Twitter, is to actually get into the schools, get into the community centres where we need to be passing these messages on.
Yeah, and I would agree with that, and I think we do a lot of that. There's a lot of health professionals from the hospitals do go out into schools, into community centres, and they do a lot of education. But you're right, we can do more, and we need to do more, and we need to help ourselves. We can't just complain that people are turning up inappropriately if they do, if we don't help and support them.
When can we expect to see your quality account reports for the current year?
They're virtually completed now. We've had to go, as I'm sure you're aware, there's a very sort of rigorous process that we have to go through, and it has to go through lots of different hoops before we can formally publish them. But I think we're almost literally within days of them being published.
Now I'd like to give you an opportunity, if you would, to share with us perhaps some of the innovative things that are happening at the hospital. Obviously we don't need to look too far to see some of the good things that the hospital's doing. But are there things happening in the very near future that will give patients a boost? I know there's a massive capital investment programme been going on for a number of years where you've invested in Burnley Urgent Care Centre and a number of other projects. Are there any other big projects in the offing?
Yeah, I mean, there's some great stuff going on. So firstly, what we're trying to do is invest in additional frontline nursing and medical staff. So I think that's really important. Just the basic staff you'll see day in, day out. In spite of all the financial pressures that we're under, and we are under a lot of financial stress, we're still investing in trying to increase the number of doctors and nurses that we employ. So, that's the first thing. We have been given approval. We've got to go through and submit a full business case, but we've been given approval to a new, really exciting development with it, which is an ophthalmic unit, self-contained ophthalmic unit. It's about a £16 million investment upon the Burnley site. I think that's really, really exciting. And the other thing that we've just done recently, we've just purchased what they've got, basically a robot to undertake robotic surgery. This is state-of-the-art stuff, and it's a real sort of statement about trying to maintain and keep services as local as we possibly can.
Right, Kevin, on behalf of the patients of East Lancashire, thanks very much for talking to us this month, and thanks for taking care of us.
Thank you.